Hello and welcome. Today we're going to talk about something incredibly important, bone health after menopause. Now I know it might not seem like the most exciting topic, but trust me, it's crucial for your long-term health. Because after menopause, a major bone fracture is associated with a very high mortality risk. So let's dive in. First off, let's talk about why bone health matters, especially as we age. The health of your bones depends on the activity of cells called osteoblasts, which create new bone tissue, and cells called osteoclasts, which destroy old bone tissue. These cells work to maintain a healthy balance. If the balance tips towards bone loss, you can develop brittle bones, which is known as osteoporosis. Bone loss does not occur overnight. Most of us start adult life with strong bones, but our bones tend to get thinner as we get older. There are many factors at play, and much is within our control. How you live your life as a young adult can dictate the strength of your bones at menopause and in old age. Your bone density is affected by many factors. It is estimated that around 62% of your brittle bones is due to genetic factors, while 38% is due to lifestyle and environmental factors. Health factors predisposing to brittle bones include smoking, drinking too much alcohol, chronic stress, inadequate dietary calcium, vitamin D deficiency, having an early menopause, lack of movement and loss of strength, living a long life into old age, and your genes, for example, if you have a family history of osteoporosis. Some health conditions, for example diabetes, thyroid problems, bowel conditions, which affect your gut absorption, such as celiac disease and some medications, are all associated with bone thinning. One of the best ways to keep your bones strong is by getting enough calcium and vitamin D. Calcium helps build and maintain bone strength, whilst vitamin D not only helps your body absorb calcium properly, but also helps fix calcium onto the bones. You can get calcium from dairy products like milk, cheese and yogurt, as well as from plant-based sources like spinach, kale and tofu. And vitamin D? You can find it in foods like fatty fish, egg yolks and fortified cereals, but your body also produces it when you're exposed to sunlight. If you can't get enough vitamin D or calcium from your diet and don't have much sunlight exposure, you can take vitamin D and calcium supplements. You can ask your doctor about this. Another key factor in bone health is staying active. Weight-bearing exercises like walking, dancing like Zumba or dance aerobics, and strength training help strengthen your bones and improve your balance, reducing the risk of falls and fractures. Now, let's talk about some habits that can be damaging to your bones. Smoking and excessive alcohol consumption can both weaken your bones over time, so it's best to avoid or limit these habits as much as possible. Chronic stress can also result in thinning of your bones. Lastly, if you have brittle bones, risk factors, or if you had a low trauma fracture, it's essential to monitor your bone health regularly. Bone density tests like a DEXA scan can help assess your bone strength and track your response to treatment. Your doctor can recommend how often you should have these tests based on your individual risk factors. There are different medicines that can help make bones stronger and lower the chance of them breaking. Medications called SERMs, like raloxifene, mainly protect the bones in your spine. Bisphosphonates, such as alendronate or zoledronic acid, can protect your spine, hips, and other bones. Other medications, such as PTH analogues or romosozumab, help your body to build new bone and are used for a short period of time in people at higher risk of fractures. Denosumab is an injection given every 6 months that works well, but needs to be continued to maintain the benefit. Hormone therapy can help bone health during menopause, but it isn't right for everyone. Vitamin D supplements can help bones and muscles, but you may need regular checks to make sure your calcium levels are within safe ranges. In conclusion, taking care of your bones is really important, especially after menopause. It is vital for maintaining your overall health and quality of life. Many of the strategies that help keep your bones strong are really good for your overall health too. Remember to get enough calcium and vitamin D, stay active, avoid harmful habits, and if you have any other medical conditions or medical treatments, you can ask your doctor if they might impact your bone strength. Your doctor will keep an eye on your bone density through regular screenings if you have other risk factors. If you have any questions or concerns about your bone health, don't hesitate to speak with your healthcare provider. Here's to strong and healthy bones.